Look, I've been in hearing healthcare now for over 20 years. I first became an audiologist and then decided to go back and study the brain some more. And that's where I really started to sort of wrap my hands around how important hearing is for brain health. And so over the last few years, I feel as though I keep sort of narrowing down my mission. I keep sort of narrowing down what it is that we're trying to do. And I got it down to 4 points, okay? First, hearing care is healthcare. So people need to understand that when we're talking about treating hearing loss, tinnitus, we're talking about treating overall health and wellness, physical health, social health, emotional health, cognitive health. So it's really important. Number two, preventing decline and dementia is possible. We now know, and there's been a number of reports showing us that it's 4 in 10 cases of dementia are considered preventable. I mean, that is a huge number. There was even a recent report that came out talking about commonly used drugs, about, Viagra. There are things that people need to know to help reduce their risk of dementia. And as I'm sure you and I will get into, the number one on the top of the list, the most important thing is treating hearing loss to help reduce the risk of dementia. So that's my number 2 sort of drive in life. Number 3 is that, and you know this all too well, reducing the experience of tinnitus is possible. There's no cure, there's no guarantee, but we now believe, and we've collected data in our centers over the last few years, which aligns with all the other published data showing that nearly 8 in 10 patients can receive relief from that ringing, the swooshing, the buzzing, those annoying sounds in their ears and head by treating their hearing loss and tinnitus. And finally, all of this comes together to really hand the keys over to our patients. Yes, you mentioned older adults, seniors, but I think that their children, the 40 to 50-year-olds, the ones taking care of mom and dad now, they need to know this too, that treating hearing loss is one of the most important keys to active aging.
We have been focusing on tinnitus, on preventing further tinnitus, on promoting habituation, on having a robust toolkit to manage it. Like you said, tinnitus can get better, and in most cases, it does. The brain can adapt to tinnitus through habituation.
But Dr. Ben, what are our patients told when they go visit the primary care doctor? What are they told by that person that they trust the most to manage their care? And I'm not trying to knock every primary care doctor, but they're told, and I quote, "There's nothing that can be done about it." And so you and I understand that frustration of not only do we have our uphill battle with our patients, but we're fighting against a mega sort of, medical community that dare I say almost dismisses people and just says, deal with it.
That negative counseling, as it's called, has an effect. It has an effect on the very centers that are driving the sustained activation of tinnitus. And some doctors, when they're communicating about this, they're looking at it very black and white, very medical. And oftentimes, if we listen closely to what they're saying, they're not wrong. They're saying, I don't have anything for you. I don't know what to do. I can't do anything. There's nothing we can do here at this medical clinic.
Sure.
And what they're missing is all that audiologist that's trained in tinnitus management or a psychologist trained in tinnitus management can perform. And that's the disconnect. Would you agree with that?
Yeah. I would absolutely agree with it. And you're a lot nicer than I am, because I usually just default to, no, your doctor's stupid. They said the wrong thing, right? That's just maybe that's the New Yorker in me that comes out sometimes. But you're 100% right there. If you took them word for word, there's nothing they can do about it. And that is true. But I think if we all really committed to that sense of, I need to help every patient. And even though I can't do something right here, right now, if you do a little bit of homework, even if you look in the AMA and the journals, if you look at the American Academy of Otolaryngology, there are guidelines for helping people with tinnitus. And as you said, the referral to the hearing healthcare specialist is right up there at the top of the list of what they need to be doing. And so it's podcasts like this. I talk about it in my book that is really helping to get out the word. And I don't see my book as being just for the patient. I see it for the family members. I see it for their doctors. I see it for the entire healthcare community.
We can prevent decline of cognitive function. Now, I'm trying to flip that 180 degrees. And essentially, I'm thinking of we can promote healthy brain function. We can promote and preserve our brain function. So, yes, simultaneously, we're preventing decline. And in the same sense, we're promoting and preserving what we already have. So,
Great way
tell
to
us
put
more
it.
about this. This is your work. This is your focus. Please tell us about your book, Preventing Decline, and the main points from it.
Look, I think those are the kindest words that people have said to me. This is my focus. I'm downright obsessed when it comes to understanding how the brain works. I'm obsessed with trying to help others out there to not go through what my family went through. We lost my grandmother some time ago, and I swear now that I've learned so much. A couple of things that come right to mind. One, if I knew then what I know now, maybe, just maybe, my grandmother could have been one of the 4 in 10 that could have prevented her dementia by, as you say, promoting cognitive health. So that's one thing that dare I say haunts me, that I think about all the time.
You had something I want to jump off of there. If I knew then what I know now, let's use that for some common situations of
Perfect.
Someone who's 65 years old. They feel good. They may notice a few things in their life that are different. If you're counseling them now, that's probably a lot different than if you were to approach that 15 years ago with all your research, your scientific study, writing books.
Exactly.
If you knew then what you knew now, how would you counsel patients who have the common signs of early stage risk of cognitive changes?
Sure. So here's what we know, right? We know that as we age, there is what's actually what doctors call mild forgetfulness. That's actually the definition that's used. So as we age, we become a little bit more forgetful. Maybe we tend to misplace our car keys more often. Maybe we tend to, walk out of a big box store and think, where did I put my car? Right. So these things, first off, they happen to everybody. They'll happen a little bit more as we get older. But then there's mild cognitive impairment, where that cognitive decline starts to impact daily life. And then there's when we get to dementia, which is a serious neurocognitive disease that impacts everyday living. And really, it starts to impact everybody around us. And so the studies that we have been looking at and some of the work I did in the lab has really been focused on why is it that with hearing loss, it increases the risk of a cognitive decline. And so we have to take this research, we have to take the known data that's out there. And as you said, we have to start counseling our patients. We have to start letting them know that, yes, it's not only important to treat your hearing loss so that you can stay connected to others, so that you can maintain relationships, but it's also important because it's like instant brain training. As soon as you start treating hearing loss, as soon as you start stimulating the brain to address tinnitus, I mean, there's active neuroplasticity and rewiring that's happening that profoundly impacts life.
Yeah. And that term neuroplasticity related to tinnitus, related to hearing loss, from your understanding of the research, how much time does it take for tinnitus to habituate? How much time does it take for a new hearing aid user to adjust neurologically to the new sound they're hearing?
Well, I'm not going to let you box me into a corner on this one because you and I both know that if we assign a number, we potentially take foot, insert in mouth, and now we have a patient who maybe doesn't have the right expectation of treatment. And so I just level with my patients, as I'm sure you do, and I just say, look, here's what the research tells us. 2 things. Number 1, the longer you've had your hearing loss, the longer you've had your tinnitus, you can kind of bank on the longer it will take for your brain to adapt. Now, if you really want to push back and assign a timeline, we hope to see changes within the first 60 days. However, there's documentation going back 10, 20 years showing 6 to 18 months for the brain to really adapt, right? If you're going to tell me that you served in Vietnam and that you have had tinnitus since then, I'm not saying it's going to take 40 more years to fix, but it's going to take a lot longer than somebody who is just, say, going through the aging process. They're 62. They've only noticed the ringing a little bit for a few months. Those are very, very, very different cases. So no promises, but realistic expectations are really key for people to understand.
If you follow Treble Health and get value from these videos, I would highly recommend that you watch the full video from this clip right here, or subscribe to this clip's channel. Every little bit counts, and your support means the world to me. This is Dr. Ben Thompson with Treble Health.